Namaskar dosto, good evening friends. I am Dr. Sanjay Kalra, your friendly and familiar endocrinologist. And you are watching Dr. KK's Med Talks. Mondays with Dr. Kalra का हमारा non-stop show का 1220वां एपिसोड है, 1220th एपिसोड. And this is the Happy Hormone series going on. इस सीरीज में हम बात करते हैं हार्मोन्स की, हैप्पीनेस की, हेल्थ की, एंड हम देखते हैं कि हम अपने हार्मोन्स को कैसे हैप्पी और हेल्दी और अपने आप को भी कैसे खुश, खुशहाल और तंदुरुस्त, सेहतमंद रख सकते हैं. Now, endocrinology and infection related medicine are usually considered separate disciplines. बिल्कुल अलग-अलग different poles of internal medicine. But growing evidence हमें ये बताती है कि there is a lot of interaction between these two fields. Let's talk about them later, but पहले let's have the headlines for the day. New evidence has reinforced the relationship between uncontrolled diabetes and tuberculosis, especially in countries like India, which share a heavy burden of both diseases. Experts continue to debate how recurrent and difficult to treat infections are worsening metabolic control and endocrine outcomes in vulnerable populations. And this is especially because certain drugs that are used in diabetes are increasing the risk of infections actually rather than reducing them. Ongoing investigations continue to examine how viral infection like COVID and SARS contribute to development of new onset diabetes, and even 6 years after the epidemic continue to impact endocrine health. One such example is post-viral thyroiditis and transient thyroid dysfunction, which occurs after viral infections. Climate-driven changes in infectious disease patterns may have significant implications for endocrine and metabolic health, warn experts. With these headlines, let's go to our topic for today. आज का topic देखते हैं क्या है. Endocrinology and infections. जैसे कि हमने कहा, infectious disease and endocrinology are considered opposite poles of the vast spectrum of internal medicine. But there's a lot in common. Good evening to Akshay Adiji, Swapna Jain madam, and hello Dr. Ermi from Ethiopia. It's good to Ermias. It's good to be with you and hope all is well with you. We have this heat wave going on in India. So we have 3 seasons across southern India, central India. That's hot, hotter, hottest. These days we are in the hottest wave. Let's talk about infections and endocrinology. Now, there's a multifaceted and a bidirectional link between these two facets of health, endocrinology and infections. First of all, many endocrine and metabolic diseases predispose to infection. For example, Cushing's disease. For example, diabetes. Hyperglycemia is associated with low-grade inflammation. It is also associated with reduced immunity, both cell-mediated and immunity-related. Neutrophil function goes down, antibody production goes down, so both humoral and cell-mediated immunity are impacted in uncontrolled diabetes and Cushing's syndrome. This increases the risk of infections throughout the body. But there are some infections that occur more frequently in people with diabetes. These will include community-acquired pneumonias, urinary tract infection, genital tract infections. Some serious diseases like emphysematous pyelonephritis, cholecystitis, these occur more frequently in people with diabetes, with uncontrolled diabetes. There are specific diseases that are associated with diabetes where screening must be done. HIV, hepatitis B, sexually transmitted diseases, and tuberculosis. Apart from all these, you will find in the diabetes clinic and in the endocrine clinic a greater frequency of skin and soft tissue infections. And these have to be treated appropriately. Why this is important for us? First of all, we need what we call glycemic hygiene and metabolic hygiene to maintain microbial hygiene. We need to be very careful. Secondly, if a person with poorly controlled diabetes contracts an infection, usually they will need antibiotics or whatever other therapy is being given for a longer period of time. It is possible that vascular function may be impaired. And a warm welcome to Ali Zakir Saab, Adab. It is possible that vascular function is impaired, and then you will need to improve vascular competency. If the person has peripheral arterial disease, then you may have to give drugs like cilostazol, like novel anticoagulant drugs like aspirin, to ensure that adequate blood supply reaches the wound and the wound gets healed. So first of all, हम बात कर रहे हैं infections and endocrinology की, and we see that poorly controlled endocrine diseases में infection का chance बढ़ता है. We talked of diabetes and we talked of Cushing's syndrome, but otherwise also patients with panhypopituitarism, patients with Addison's disease, they also have high chances of infection. Testosterone थोड़ा सा confusing है. There are some studies which say that high testosterone is associated with greater risk of viral infections like COVID. There are other studies which say that people with low testosterone have higher risk of COVID. तो यहाँ पे मिक्स्ड रिजल्ट्स आते हैं रिसर्च से. तो एक तो हो गया कि एंडोक्राइन डिजीज से इन्फेक्शन बढ़ती है, बट एंडोक्राइन ट्रीटमेंट से भी इन्फेक्शन बढ़ सकती है. व्हेन यू गिव कॉर्टिकोस्टेरॉइड्स टू अ पेशेंट, अगर आप ओवरडोज कर दें तो इन्फेक्शन बढ़ सकती है. जब आप एंटी डायबिटिक ड्रग्स देते हैं, लेट अस से वी गिव अ ड्रग लाइक एकारबोज और जीएलपी-1 रिसेप्टर एगोनिस्ट, इससे अगर जीआई मोटिलिटी में डिसफंक्शन हो तो इट कैन प्रेसिपिटेट अदर जीआई इन्फेक्शंस. SGLT2 inhibitors can precipitate genital tract infections. And pioglitazone in some studies may be associated with the risk of bladder infection. Hypothyroid, Akshay Addy ji पूछते हैं, are people with hypothyroid associated with high risk of infections? And many studies say yes. But याद कराएं कि it is not hypothyroid or diabetes. It is uncontrolled hypothyroid or uncontrolled diabetes which is associated with high risk of infections. If we control our pituitary, thyroid, adrenal, and glycemic health, if we keep it under control, then usually we should not suffer from infection. So एक तो endocrine disease से infection बढ़ती है if it is uncontrolled. Endocrine drugs से भी कभी-कभी infection बढ़ सकती है. एक और तरीका है इन्फेक्शन का, दैट इज व्हेन यू गिव इंजेक्शंस. तो जब हम इंजेक्शन देते हैं, वेदर इट इज टेस्टोस्टेरोन और वेदर इट इज इंसुलिन, देयर इज ऑलवेज अ रिस्क ऑफ लोकल साइट रिएक्शंस एंड लोकल इन्फेक्शंस, स्पेशली इफ बेसिक हाइजीन इज नॉट मेंटेन्ड. जब भी कभी इंसुलिन का टीका लगे या GLP-1 आर का, तो कहा जाता है दैट द स्किन शुड बी सोशली क्लीन, विच मीन्स इफ यू आर विलिंग टू टच द स्किन, शेक हैंड्स, फील इट, दैट मीन्स इट्स सोशली क्लीन. But for testosterone and other IM injections, let us say HCG का टीका लगना है, testosterone का लगना है, then you have to use spirit and ensure good asepsis before injecting. Now let's look at the opposite perspective. Infection leading to endocrine dysfunction. And yes, that's true. Infection can occur in each and every gland. Pituitary, thyroid, parathyroid, जबकि बहुत rare है, pancreas as well, adrenals and gonads. कहीं पे भी infection हो, whether it is oophorytis, orchitis or adrenalitis, there will be a risk of endocrine dysfunction. That endocrine dysfunction can be transient, it can be permanent. And काफ़ी सारे diseases हैं, जैसे Addison's disease, where the commonest cause is infection. Tuberculosis or fungal infection can cause Addison's disease. Sometimes sepsis can present as a pan-endocrine illness. तो जब sepsis होगा, पूरी बॉडी में sepsis होता है, तो सारे के सारे हार्मोन्स हिल जाते हैं. One example is sick euthyroid syndrome. So somebody in sepsis, somebody with infection for a long period of time will present with low T3, T4, TSH. इसको बोलेंगे sick euthyroid syndrome. But that doesn't mean कि आप thyroid की दवा देंगे इनको. In general, when severe infection occurs, the hypothalamo-pituitary-adrenal axis gets activated. तो cortisol increase होता है. But कभी-कभी cortisol दब जाता है. This is when the body stops fighting. और इसको बोलते हैं koala bear syndrome. Koala bear syndrome इसलिए बोलते हैं because koala bear is that animal which has a vestigial adrenal gland. That's why you see that koala bears are not able to manage stress. They are not able to reproduce also in captivity, and their lifespan goes down. So, if someone is admitted in the ICU with an infection or otherwise, if cortisol level goes up, that's normal. It means the body is fighting back. But if cortisol levels remain low, we call it koala bear syndrome, and that actually is a sign of poor prognosis. जब इन्फेक्शन होती है, जब सेप्सिस होता है, तो बॉडी अपना थ्राइविंग मोड के बदले सर्वाइविंग मोड में चल जाती है. इट गोज इनटू सर्वाइवल rather than thrival mode. And you will find that the thyroid axis gets depressed, testosterone also goes down. Women may get amenorrhea because the body is just trying to preserve itself. So first of all, we saw that endocrine disorders can lead to infection. Then endocrine drugs can also lead to infection. But infection can also cause endocrine disease, which can be localized, which can be generalized. Sepsis itself is a pan-endocrine illness, and the numbers can mimic endocrine disease, like in sick euthyroid syndrome. Microbial endocrinology is the name given to this subject कि बैक्टीरिया कैसे जवाब देते हैं या वायरस कैसे जवाब देते हैं हमारे हार्मोन्स को, एंड हार्मोन्स कैसे जवाब देते हैं हमारे बैक्टीरिया को. जैसे कि फॉर एग्जांपल somebody with insulin resistance will have a different type of sweat, a different type of odor, different skin hygiene, and hidradenitis suppurativa might occur. Microbial endocrinology का ये भी है that we can use microbes like E. coli and Saccharomyces. ये भी microbes हैं, they are bacteria and yeast. We can use them for rDNA technology to make insulin, to make semaglutide. And many of the drugs that we use, growth hormone, semaglutide, insulin, all these are based upon rDNA. They are based upon microbial technology. So many different aspects of microbial endocrinology are there. How can we prevent? एक क्वेश्चन अक्षय आईडी जी पूछते हैं, कैन थायरॉक्सिन कॉज इन्फेक्शंस? Not that I am aware of, but if you give the right dose of thyroxine, things should be fine. HbA1c in general, Dr. Armia says we should have less than 7 for everybody and as low as possible for women in pregnancy. So if somebody asks you what should I aim for, in general it should be 7 or less. Implications, how do we prevent? First of all, like we said, good metabolic hygiene, good glycemic hygiene. Then in general, good hygiene, skin, soft tissue hygiene, so that we are able to take care of ourselves, good respiratory hygiene, and also vaccinations. So vaccinations are important for people with diabetes, diabetic kidney disease, Cushing syndrome, others with who are at risk of infection, who are immunosuppressed, like those with adrenal disease. Speak to your doctor to see locally what vaccines are suggested. इंडिया में ज़्यादातर वी वुड सजेस्ट हेपेटाइटिस बी वैक्सीन फॉर एवरीवन. रिमेंबर कि अगर आपको डायबिटिक किडनी डिजीज है देन यू विल नीड डबल डोज ऑफ हेपेटाइटिस बी. Also, influenza vaccine and pneumococcal vaccine are indicated for the vast majority of Indians living with diabetes. Another vaccine that is indicated now in many people is that of herpes zoster or shingles. One aspect is vaccination that we talked about, but the other aspect is that suppose somebody developed a viral infection, a difficult to treat infection, then do screen for endocrine illness, at least clinically, if not biochemically, and keep an eye open, keep a high index of suspicion for development of endocrine disease in future. Be culturally appropriate as well. So some of us live in Ethiopia in the Horn of Africa, others live in South Asia. Dengue, chikungunya may be common in some parts and malaria in other parts. When we treat these, we have to be very careful. Anti-malarials can cause hypoglycemia. Malaria itself can cause hypoglycemia. Some of the drugs that we use, like levofloxacin and gatifloxacin, can cause hypoglycemia on their own. Others can cause hypoglycemia through drug-drug interactions. For example, itraconazole. So be aware of the drug interactions and be aware of the common causes of acute febrile illness in your part of the world. In case you have someone with diabetes who has developed an acute febrile illness, is catabolic, is not eating well, it might be a good idea to start on insulin for a short period of time. This is also a part of metabolic or glycemic hygiene. इंसुलिन के साथ इम्यूनिटी बढ़ेगी, इम्यूनिटी स्ट्रेंथन होगी, इट विल बिकम स्ट्रॉन्गर एंड वी विल बी एबल टू फाइट द इन्फेक्शन बेटर। तो आज का हमारा टॉपिक था एंडोक्रिनोलॉजी एंड इन्फेक्शंस, एंड 15 मिनट में, इन 15 मिनट्स वी बीन एबल टू एक्सप्लोर सो मच अबाउट मेडिसिन, endocrine drugs, diseases causing infection, endocrine drugs causing infection, infections causing endocrine disease, infections like sepsis mimicking endocrine disease, drugs used for infection causing endocrine disease, like for example, hypoglycemia. एक और सडनली व्हाट कम्स टू माय माइंड इज जापानीज एनकेफेलाइटिस, जो एक एपिडेमिक थे उत्तर प्रदेश और बिहार में, एंड फाइनली इट वाज फाउंड आउट दैट दीज वर नॉट वायरल इन्फेक्शंस, दिस वाज एक्चुअली टॉक्सिन इंड्यूस्ड hypoglycemia. The toxin was there in the unripened lychee fruit, and that was causing hypoglycemia. That's another aspect of pseudo infectious or pseudo microbial endocrinology. Thank you, Akshay, for being with us. The fact that you are with us, that makes us more enthusiastic. And we have Dr. Armias from Ethiopia today. It's a great feeling to be able to connect with you. सबको बहुत बहुत शुक्रिया, धन्यवाद, मेहरबानी कहेंगे, थैंक यू कहेंगे for being with us today. This is Happy Hormone series going on. And as we sign off, थारा भला हो, सबका भला हो, stay happy, keep your hormones happy, and Jai Hind.